screen. There we go. Hi there, folks. Thank you for joining this afternoon. My name is Harriet, and I am the partnerships lead at Wellio Education. I'm also joined by Dan, who is one of our senior content writers, and also Ruben as well, who, if you're a client, you will know as your school success manager. They will be manning the chat, so they're very much on hand to answer any questions that you may have throughout this presentation. So what are we going to be covering this afternoon? We're going to be taking you through over the next 20 minutes or so what the new statutory guidance actually is. I'm also going to be covering some of the key kind of thematic changes that we've noted. I'm also going to take you through Wellio's updated curriculum map. I'm also then going to cover a few points about your school's RSHE policy. And finally, I'm just going to end with some of our trial lessons we have to offer you. So if you do want to sample any of the new lessons within the guidance, you'll be able to do so. And just next steps from here. As I said, feel free to pop any questions in the chat as you go through, and Dan and Ruben will be more than happy to answer. So let's kick off. What is the new statutory guidance? As you all know, earlier this year, the government announced new statutory guidelines that would replace the ones from 2019, and schools are expected to align with it from September 2026 onwards, which really doesn't give schools a huge amount of time to prepare. And the new guidance outlines the fundamental topics around RSE and health and wellbeing that schools should be covering. What we're going to be doing is guiding you through an overview of the changes, and we'll be focusing primarily on the new topics you need to teach that you didn't have to previously, and what that means for your school. But in short, there are several new topics that have to be taught in Key Stage 3 and Key Stage 4 that weren't in the new statutory guide, weren't in the 2019 guidance. This results in the guidance being substantially longer and a lot more comprehensive. So I'm going to dive into that a little bit now. So, the old guidance for RSE and health and wellbeing was in total comprised of 65 dot points. The new guidance totals 115 dot points, and they only removed 5 from the original guidance. So, what that means is there are 50 brand new dot points that weren't present in the original guidance. They're also bolstering pre-existing sections, but also introducing many new ones. And there are 40 topics which have been updated in their wording and have become a lot more granular in their description, which we'll go through shortly. We have also noted, as we've kind of done this audit process, is that there is a much greater degree of overlap in the new guidance compared to the old guidance. So let's dive into this a little bit. So in RSE, in the old guidance, there were 37 dot points. And in the new guidance, there are 63 dot points. Some of those changes in terms of themes include topics like impact of incels, deepfakes and AI literacy, AI chatbots, strangulation as a crime, stalking or obsessive behaviors, criminal exploitation and grooming, and identifying and reporting abuse. So some really heavy topics in there. In physical health and wellbeing, there were 28 dot points in the old guidance and 52 in the new guidance. And some of those new themes include things like limiting screen time, online gambling and risks with gaming, fertility and menopause, serious health conditions, content related to self-harm, unhealthy weight gain, local healthcare, safety on roads, menstrual health. So a lot of topics. And to be honest, this is quite a lot of pressure that is put on schools to ensure that they're not only writing all this content in time, but also writing and delivering it safely as well. So there's a lot that has to be covered. What we've noticed in kind of those kind of thematic changes, some of the things that we really noticed, first and foremost, is that there is a massive emphasis on safety. Being safe in RSE, in terms of that subtopic, went from 2 dot points to 16 dot points. And there is also a brand new category of personal safety, which was created for health and wellbeing, outlining topics like road, water safety, railroads, independent travel, knife crime, and exploitation. So a huge focus on safety. One of the other things that we noted was a focus on the new tech landscape. So there are a lot more kind of topics or subtopics which have been introduced on things like deepfakes, AI, sextortion, online scams. What we also noted as well was there is a much greater specificity about health than there was previously. And so now what the new guidance outlines is actual specific conditions, focusing on their incidence, but also the prevalence as well. There's also much greater specificity on healthy pregnancy behaviours. And it really kind of dives into topics like folic acid, pelvic floor health, things like polycystic ovarian syndrome as well. And there's also the inclusion of things like the Gillick competence and accessing local healthcare systems, ensuring that kind of young people are able to advocate for themselves medically. However, one of the things that we kind of key things to note about the new guidance is it's not just about identifying new topics or dot points. It's also adapted a lot of points in the previous guidance to make them a lot more granular and specific. And I'll take you through a couple of examples here, one of which is already on the screen. So in the old guidance, this is an example. It says that pupils should know the importance of sufficient good quality sleep for good health and how lack of sleep can affect weight, mood, and ability to learn. In the new guidance, it's been reworded. So it says the importance of sufficient good quality sleep for good health and the importance of screen-free time before bed and removing phones from the bedroom and how lack of sleep can affect weight, mood, and ability to learn. The other example here kind of refers to alcohol. So it says people should know the physical and psychological risks associated with alcohol consumption and what constitutes low risk alcohol consumption in adulthood. But now they've obviously added a few extra sentences here, which focuses on the legal age of sale for alcohol in England and understanding how to increase personal safety while drinking alcohol, including how to decrease the risks of having a drink spiked or of poisoning from potentially fatal substances such as methanol. So they've gone into a lot more detail here, which means that there's a lot more that schools obviously have to cover. So what does this mean? The point is that this is going to involve two separate activity sets. Number one is amending pre-existing PSHE resources to align with granularity, as per the examples that I've just talked you through. But it also means creating brand new lessons to cover the new topics. If you are doing this alone, this is going to take ages. We've kind of assumed about hundreds of hours, to be honest. Thankfully, Wellio is already across this. And for those of you that are working with us, we are doing this for you already. Our plan is to update 68 lessons, but we'll be also writing 40 plus brand new lessons to ensure complete mapping to the new guidance. All of this is going to be done for you. In fact, we've actually already written a lot of the new content which is included in the new statutory guidance. For example, we have lessons on topics like sextortion, AI, deepfakes, online grooming, child exploitation, knife crime, incels, and online masculine subcultures as well. So the good news is we have a lot of it, but we're also writing the kind of and updating the new content at the moment. And the plan is that we will have this completed by April 2026 at the latest. And the reason it's April 2026 is not only are we editing, obviously, the senior curriculum, we are also writing a careers programme and we are also updating the primary programme as well. So what we've done, though, to share with you now is we have created a brand new curriculum map to show you what it looks like and how we have recommended that you as a school can spiral your content. So what does this actually look like? I'm going to talk you through this document and all the colours in just a moment. But with the new guidance covering 150 new dot points, plus the 21 topics across British values and citizenship, it means that trying to cover every curriculum dot point in Key Stage 3 and Key Stage 4, even with a weekly session, to be honest, is quite challenging. So what we've done here is we have built an example recommended spiral curriculum. And I'm going to share the spreadsheet with you now so I can dive in a little bit. So what you'll see here is a few different colours. And what we have done as per our previous sequences is we have spiraled the programme. Now, any lesson that you can see in yellow is a lesson that we are updating. And we are amending existing content to reflect the new changes and for those dot points that have become a bit more granular. Anything in bright blue is either a brand new lesson that we are writing or it's an existing Wellio lesson that we already have in the library that aligns to a new dot point. For example, we already have a lesson on managing emergencies, but it's now mapped to a new dot point in the statutory guidance. However, we are going to be writing a brand new lesson on the healthcare system. So these blue lessons show you the brand new lessons which will be included. So this is an example spiral program that we have created. And what we will do, folks, is we will send this to you after this call as well. So you have this as an example. What you will also see when you have a look at this document is you'll also see the curriculum map. So what you'll be able to see across all of RSE and health and wellbeing for all of the new dot points, which lessons we have mapped to that guidance, and we will also evidence for you here how it has been spiraled. So in column C, it's Key Stage 3, in column D, it's Key Stage 4. And what you can see here is we have ensured that you can still build up understanding of topic areas age appropriately. So we will share this with you after this call. So what does this mean for spiraling? Obviously, as I said, there is a lot that has to be covered. What we have done when we've gone through this process is we have determined areas which we think should be trimmed down to maximise guidance coverage. First and foremost, it's financial literacy. For those of you that are working with us already, you know that we have about 30 financial literacy lessons. We've still included it in our updated curriculum maps. However, now it's roughly around kind of 1 or 2 lessons per year group, as opposed to kind of previously where there was probably a bit more. So we've trimmed that down to make space. We've also trimmed down lessons around mental health and emotional literacy. Those lessons are still in there, but to a diminished extent. And that was a call that we had to make to ensure that you could still fit everything in and spiral it. We've also made judgments about which dot points should be spiraled. And when we say spiraled, we mean covered in both Key Stage 3 and Key Stage 4. For example, our sequences have lessons in both Key Stage 3 and Key Stage 4 addressing the healthcare system, as there are 3 new dot points on it, but we have deprioritised vaping in Key Stage 4. We've also determined that AI should be delivered comprehensively across all year groups versus the topic of strangulation, which we think should be delivered probably only in Key Stage 4. That being said, we are providing our judgment here. Our goal is to ensure that you have the flexibility. So as I mentioned, we're writing 40 plus new lessons. And what that will do is it will give you choice. So you can decide, A, which lessons are going to be most appropriate for your students, but also so you can decide how you want to spiral it. So we'll give you kind of full ownership over that process. This is merely a recommendation of what we think a good spiral program will. We know that you know your students far better than we do. So that's a bit about spiraling. We'll share this with you after. As I said, the lessons will be written by April 2026. What I wanted to do now was just very quickly take you through some of the key points that were also mentioned in the very meaty PDF that you may have read from the government, just to kind of reference them, but also show you how Wellio will support. So one of the things that they mentioned was about a good RSHE policy. First and foremost, they mentioned about engagement with pupils, saying that an inclusive and well-sequenced RSHE curriculum should be informed by meaningful engagement with students to ensure it's relevant and engaging. And that's what we'd really try and make sure as our lessons are activity-based, they're engaging, they're relevant, and they're up to date. The other thing it mentions, this is not necessarily something new, it's in the previous guidance, is about engagement and transparency with parents, and that parents obviously have the right to know what's being taught. One of the things that we try and make sure is that your feedback loop with parents when using Wellio is really strong. As I said, for those that might have done this already, we can do a little session for parents, running them through the guidance, and we can also set up a parent account so they can actually see the content that's being delivered. The other thing they mention is about positivity, so ensuring that they're focusing on building positive attitudes and skills and promoting healthy norms about relationships. I'll come back to that point in just a second. They also mentioned about careful sequencing, so covering all statutory topics and also ensuring that that information is essentially spiraled. And so, as you know, with Wellio, it's a partnership. We are here to help you build your program, especially as we kind of enter this kind of slightly new territory. We're building these sequences. We are very much on hand to support you with the sequencing of your curriculum as much as you need. They also talk about a program being relevant and responsive, and that it should be age and stage appropriate. Obviously, that comes into the sequence building, but as you know, with your Wellio program, you can update your sequence of lessons at any time, ensuring that your program is responsive and that you're in the driver's seat for what students hear and when. They also talk about skill delivery of participative education, ensuring that staff feel well trained and that they're able to facilitate good quality lessons. Obviously, our lessons are designed to ensure that any teacher, irrespective of their confidence, can deliver a strong lesson. But obviously now there's a lot more kind of topics in there, especially quite hard-hitting ones. So we do have our staff training. The lessons are designed to support them, but we also have as well the offer of a more detailed CPD session. So if you want to run a kind of more detailed staff training that really goes into topics like answering difficult questions and creating that kind of productive classroom environment, we also have that to offer you as well. And finally, as well, the whole school approach. Now, largely, this is also kind of down to the school, ensuring that it's supported by policies and behaviour and safeguarding policies. But that also is where we can come in as well in terms of designing your programme. It's part of the reason we've also now introduced primary and have built spiral programmes from early years to year 13 to ensure that there's that kind of whole school spiraled approach. So that's a bit about how Wellio supports there. I'm now just going to briefly go take you through some of the additional dot points outlined in the new guidance that warrant attention. They're not specific curriculum dot points, but they're designed to kind of guide the teaching of content. First and foremost, that was their participative element. Basically, it says that effective teaching will be interactive and involve critical analysis of relationship scenarios. Wellio's lessons are not designed to solely be knowledge resources. All Wellio lessons contain activities, interactions, and many involve specific scenario analyses at the end of the lessons. For example, our lessons on consent involve scenarios where students need to determine whether consent has been given. And different kinds of intimacy, which is a lesson which has recently been updated, explores the role of sexual pressure and the interplay between intimacy and scenarios. So that's how we help on that front. And secondly, it was about kind of this idea of kind of abusive behaviour and how the school will cover it. It comprehensively covers abuse and sexual harassment. All Wellio lessons that have been written on sensitive topics are written with the support of a psychologist. So those include our lessons on domestic conflict, domestic abuse, sexual violence and abuse, and including the new lessons we're writing on sexual harassment and aggression. So ensuring that you can rest assured that it has been written with the support of a kind of a real professional. The next thing I just wanted to address was about suicide prevention. The guidance mentions it a lot in the bullet points, but it isn't always necessarily referenced in the specific dot points. There are actually only 2 specific dot points in the curriculum guidance that specifically reference suicide, and that's in relation to gambling and viewing harmful content. However, suicide prevention is based around the mental wellbeing curriculum, which we have covered comprehensively. So we have a Key Stage 3 and a Key Stage 4 lesson specifically about online content oriented around self-harm, suicide, and the impact it can have on our mental health. Those lessons are online content and mental health and viewing harmful content. The new guidance also has 2 dot points that specifically addresses loneliness and feeling down, which we have also addressed alongside other preventative lessons. So things like combat worry, stress and anxiety, the stress scales, managing stress and overthinking, and managing anxiety. If you would like access to those lessons or pointed in the direction of those lessons, let us know and we can point in the direction of those. But that's just a bit because it talks about it a lot in the guidance, but it's not always referenced that much in the specific curriculum dot points. Finally, as well, it's just covering this point here, which was quite a kind of convoluted sentence to unpack. So it talks a bit about the idea that anyone can be a victim of sexual violence, that most sexual violence is committed against women and girls. It's often gendered. However, teachers should avoid language which stigmatizes boys or suggests that boys or men are always perpetrators and that girls are always the victim. So it can be considered a little bit of a contradictory statement, but what I just wanted to raise here was that sexual violence is something that Wellio also covers comprehensively. We have 6 lessons explicitly about consent, coercion, and power. We also have 5 lessons about sexual violence and harassment. And just important to note that the topic of gender violence is really complex and it requires some nuance. So all of our Wellio lessons are rooted in factual evidence and research around these issues. We really take about kind of 10 or so hours to research every lesson. And as I said, these lessons are written with the support of a child psychologist as well. And what we will try and do is always make sure we're framing those lessons by, acknowledging that it's sensitive and making sure that students are aware of that before a lesson gets started. Now, as I mentioned at the start, folks, we have the opportunity for you to actually try some of these lessons. What we have done is we have built some recommended sequences just with some sample lessons of the new statutory guidance. We've done these for Key Stage 3 and Key Stage 4, and we've also done some for primary as well. This is Key Stage 3. So if you would like to have a look at any of these lessons, deepfakes, AI, masculine narrative, sextortion, explicit sexual imagery, you can have access to these no trouble. We have saved these as pre-populated templates. And we've also done them for Key Stage 4 as well. And so those are lessons on like AI in society, deepfakes. So you can see some of that spiraling that we've done, but also kind of gang violence, and especially covering those new topics of safety. So emergencies and exploitation. So if you would like access to those, it brings me to next steps. What we will do is we will send across this recording, first of all, after this session. What we are also going to do is send you a link to this curriculum map. So we will send you a copy of this so you have it. And if you would like to access those lessons, if you are a client, obviously just reply to Ruben, we'll add it to your account. But if you are a school that doesn't currently work with us, we are very happy to set you up with a completely obligation-free trial. You can sample those lessons and any other lesson. What we'll do is when we send the email, we'll put a link in our calendar so you can set up a quick call and we can get you set up with those lessons. But folks, that is the end of the session today. Thank you so much for joining. I think we will pause there. I don't think we have time for questions. I think we're about to lose our, our Zoom time. So yeah, we will leave it there. But thank you so much for joining. And yeah, we'll send you all an email later today or first thing tomorrow morning. Thank you, everyone.